And this week's Wellness Wednesday, May is National Stroke Awareness Month, but we are raising awareness about it today because strokes can happen to anyone at any age. Joining us now is Kelly Jo Thornton, neurology hospitalist nurse practitioner. How are you, Kelly Jo?
I'm great. How are you?
I am doing all right. Thank you so much for joining us this afternoon. So, what is a stroke?
So you have two types of strokes. You actually have an ischemic stroke. An ischemic stroke accounts for about 85% of our strokes. An ischemic stroke is when you have a blood vessel in part of your brain that's blocked off by a blood clot. That causes decreased blood flow in that part of the brain, which in turn causes damage to that part of the brain. And then you have a hemorrhagic stroke. Your hemorrhagic strokes account for about 15% of your strokes. That is when a blood vessel in part of your brain bursts, and that causes a bleed in your brain.
Wow. Now, when it comes to symptoms, what are some of the symptoms people need to be on the lookout for?
So there's an acronym that you can remember, and it's called BFAST. BFAST stands for balance, eyes, face, arms, speech, and time. Balance, whenever you see somebody off balance, when they're walking from one side to the other. Eyes, whenever you see somebody that's got vision problems, if they can't see one side or the other, double vision or blurry vision. Face, facial drooping, numbness or tingling on one side of the face. Arms, if they have weakness in their arms, one side or the other, or their legs, one side or the other, numbness or tingling in one side or the other. Speech, slurred speech, trouble getting their words out or trouble understanding what somebody is saying. And then time. Time is of the essence. We say in the stroke world that time is brain. You need to call 911. If you see somebody that you think is having a stroke or you think you're having a stroke, then you need to call 911 because there's things that we can do nowadays for people that think that they have a stroke. There's interventions and there's medications now that we can give. So you need to call 911 and get to the hospital as quick as possible.
And we do have some tips to be able to pass along to our viewers when it comes to stroke prevention. If you can go over these tips with us.
Sure. So you need to keep your yearly checkups with your doctor. Your yearly checkups, you can check your cholesterol, and then you can check your hemoglobin A1C. Your hemoglobin A1C will tell you what your blood sugars have been for the past 3 months, and that can tell your doctor about, your sugars, tell you whether you have diabetes or not. You need to monitor your blood pressure at home. Monitoring your blood pressure with the doctor will not tell you what your accurate blood pressure is, so you need to keep a check on your blood pressure at home. You need to stop smoking. You need to keep a balanced diet. Some other things that you can do is obesity, so watch your weight, and then uncontrolled sleep apnea.
Wow. All right. Well, thank you so much, dear Kelly Jo, for joining us this
Thank
afternoon and for giving us all those wonderful tips to make sure that our viewers will not become a stroke victim.
Thank you
so
for
much for
inviting me.
joining us.